Good evening and thank you for joining us. Officials with the Ministry of Labour are on site at the Resolute Sawmill in Ignace investigating a workplace fatality.
The death occurred Monday evening and was reported to Ignace OPP just after midnight Tuesday. Sources say a woman employed by an outside contractor was crushed in the debarking area of the sawmill. Resolute sent a message to all employees saying, "The death of a worker is the realization of their worst fears, and that it is cooperating fully with the Ministry of Labour." The company has also launched its own probe and says it's determined to get to the bottom of what happened and take corrective action across all their sites. The Ignace sawmill reopened last year following a 2-year hiatus, but the operation has been temporarily halted as a result of the death. Resolute CEO Remy Lalonde and other executives have traveled to Ignace to support those affected by the tragic incident.
The emergency department at Red Lake's Margaret Koshner Memorial Hospital is back up and running following a 24-hour shutdown last weekend due to a lack of physicians. But officials with the hospital say the potential for a repeat incident there or at another hospital in the region is very real. Adam Riley reports.
The fact that we have to make a decision to close an emergency department for an entire community who are not expecting it, they deserve better than that. This community deserves far better than that.
Chief of Staff Dr. Akila Wiley has been practicing at the Margaret Koshner Memorial Hospital in Red Lake for just less than 2 years. She says the decision to close the ER for 24 hours on March 26th due to a lack of physician coverage was disappointing, but also sees it as a chance to start a dialogue.
In making light of the whole situation, a lot of education is coming from it, opportunities like this to talk about it and inform our communities that, we really are in dire circumstances and we're starting to get very, very tired keeping our departments open.
The closure meant anyone in Red Lake or nearby Ear Falls would have to travel to Dryden, some 2.5 hours away, for emergency care, which did occur as 2 ambulances were dispatched from the base in Red Lake. The Kenora District Services Board confirms that with both their ambulances gone, the community was without paramedics for several hours. Sue LeBeau is the Chief Executive Officer for the hospital. She says a key problem is a discrepancy between the number of doctors dedicated to the community based upon its population versus the number of people who use the hospital and its emergency department.
So we are rated for 7. And that includes all the primary care that has to be done. I mentioned a while ago that we support about 6,000 residents, but what's not counted in there are the miners that fly in, fly out. For instance, there's a whole contingent as well that does that. Tourism is another one. When we see tourism ramp up again, our population can get significantly larger in the summer.
Red Lake's Chief Administrative Officer says following the announcement of the ER closure, the municipality declared a state of emergency to bring awareness to the situation.
This shouldn't happen in Red Lake, and it shouldn't happen in any other community. So we're very concerned, and we're looking for assurances that this does not happen in the future.
And while the crisis has subsided, hospital officials stress unless significant changes are made from a human resources perspective, another closure of the Red Lakes ER or another ER here in the Northwest will only be a matter of time. Adam Riley, TVT News.
That temporary closure of Red Lake's ER has led to a lot of criticism directed at the government in the Ontario legislature this week. Today, NDP leader Andrea Horwath questioned the Ford's government's commitment to health care in the far reaches of the province.
It is unacceptable. It is absolutely not okay or safe that this situation exists in our province. My question is, why hasn't Premier Ford done what he needed to do to resolve this? Why has he abandoned the healthcare needs of Northerners?
The newly ratified Ontario Medical Association Ministry of Health agreement has introduced a 4% base salary increase to a number of groups, including the physicians practicing out of Thessalon and Bruce mines. So that is the action we are taking.
There's another jump in COVID-19 hospitalizations across the province today. There are 807 patients currently in hospital in Ontario and 166 in the ICU. And the provincial positivity rate is now the highest it's been since January. Here at the Regional Health Sciences Centre today, there are 24 patients in hospital, 1 more than yesterday. 8 of those people are in the ICU, up from 7. The hospital's occupancy rate has increased to more than 102%, while the occupancy rate inside intensive care is at 86%.
Ontario Health Minister Christine Elliott insists the province will stay the course and is unlikely to reimpose any public health restrictions. Her comments come as cases rise across the province, and many local health officials urge their residents to keep masking in indoor public settings.
This was not unexpected that we would see the numbers continue to go up, but we do have the capability in our hospitals to manage any increases. And Dr. Moore is of the view that at this point we are able to now learn to live with some continued cases of COVID. Unfortunately, it's not going away completely just yet, but we need to move on and continue with first of all, the opening of our economy, but also so that people can get back to a more normal way of life.
4 people were taken to hospital following a major highway crash yesterday afternoon near Sunshine involving 3 tractor trailers and a passenger vehicle. It happened just after 2:30, about 5 kilometers west of Sistonen's Corner. Images posted to social media show a massive amount of damage, with some of the trucks having jackknifed. Others were left flipped over on their side in the ditch, with vehicle parts and cargo littered all over the roadway. OPP say 1 person suffered a serious but non-life-threatening head injury. The other injuries were all minor. Highway 1117 between Sistonen's and Finnmark Road finally reopened around 2:30 this morning following a 12-hour closure. There's no word yet on whether any charges will be laid.
Getting to appointments, accessing harm reduction, or just finding a place to keep warm will be more difficult after today for some local residents, as the Care Bus is now parked for the season. The Care Bus provided more than 4,000 rides over the winter, taking clients to appointments all across the city or just giving them a place to get out of the cold between December and March. The program also provided food and water, clothes, and harm reduction supplies. The Care Bus is run by Northwest Community Health Centers. CEO Juanita Lawson says it fits into their vision of health equity, social justice, and filling gaps in the community. She also credits the local Indigenous Friendship Center, which helped fund the Care Bus, allowing it to operate twice as long as it did last year.
Whether it's accessing services or receive primary care, or to meet with their Ontario Disability Support Worker, or get access to housing, like those are things that our workers were able to do in a different way because of the length of time that the service was available.
So unfortunately, when services like the Care Bus suspend, the clients are left without those resources and they just don't access them.
I think one of the most important things that we offer is acceptance to people who maybe feel looked down upon. That's one of the things we do. We serve them, we accept them for who they are and where they're at, and we help support them in what they want to do and what they want to accomplish with the rest of their lives.
Care Bus organizers say despite the arrival of spring, they wish they could extend the program, at least until the colder April weather has passed.
The Thunder Bay Public Library Board has announced it's begun searching for a new chief librarian, as current library CEO John Pateman is stepping aside later this year. Pateman will finish out his contract with the library in September. During his 9+ years as CEO, he led the library through a restructuring process, 2 strategic plans, and of course the pandemic. Pateman wasn't available for an interview today, but Library Board Chair Carol Grieve says they want to publicly thank Pateman for his contributions to the library.
The Thunder Bay Public Library is a very different place than it was when he came. There's much more diversity and inclusion, and John has taken on a lot of partnerships. One example is we have Anishinaabe Education and Training downstairs here in the Waverley Library, Science North, and so this has become a real community hub in his tenure.
An executive search firm has been hired to help the library board find Pateman's replacement. Grieve is confident the board will have someone in place in time for the transition in September.
The first in-person job fair in Thunder Bay since the pandemic began was held today at the Valhalla Inn. Organized by Dougal Media, the Opportunities Northwest Job Fair allowed employers and potential employees to connect face-to-face. Vasilios Bellos has the details.
Hundreds of people came to the Valhalla for the job fair, where over 50 exhibitors from a wide range of industries had set up booths. There was also a section set up away from the exhibitors to help people with resume building and interview tips. Event consultant Nancy Mullaney says she was ecstatic with the turnout and talked about the importance of the occasion.
There is so many employers that have such a shortage of employees. So this is an opportunity for everybody to get together and find out, and there's a lot of opportunities in our region, so and such a variety of sectors as well. So this is really important for the employers, and I know they're really grateful to be here today.
Many businesses seeking employees and those looking for work have found things very difficult during the pandemic, as job fairs were forced into a virtual setting. Katie Mackey was there representing Nordman Group of Companies and stressed how important these events are, knowing some of the pandemic difficulties firsthand.
I'm a newer hire myself, so I had to do the whole email channel, and it's a little more intimidating because you don't get to see a face, you don't get to go and have a conversation and get a feel for the people you're going to be working with or working for. And so, you know, coming into a job fair where you actually get to discuss the company in person, it's so different.
The Opportunities Northwest Job Fair was clearly a success, with events like it the perfect way for employers and potential employees to once again meet face-to-face. Vasilios Bellows, TVT News.
A group of young performers from Eleanor Drury Children's Theatre will bring their rendition of some classic Oscar Wilde stories to life. The first presentation of Wild Tales goes tomorrow night at Magnus Theatre, featuring a talented cast of young actors.
The giant had gotten stuck in a very long, very dull conversation for 7 years.
The lighthearted production is geared toward children, but the whole family will find something to enjoy. Eleanor Drury Children's Theatre is a charitable organization that's operated since 1982. Alexa Shermack is the director of Wild Tales. She hopes the production will inspire the next generation of performers.
Maybe the young people who come to see the show can see themselves up there too. You know, just sort of like some of our young people say that they came to see a show and they saw somebody on stage and were inspired to join, right? So I'm hoping that some of our audience members feel the same and are inspired to, if not join our group, to try theater or to try something in the arts.
Eleanor Drury has been a source of a lot of comfort and a hell of a confidence boost for me. And it's been a really great part of my life.
Tickets for Wild Tales are available on the Magnus Theatre website. The first show is at 7 o'clock tomorrow night. There are also 2 more on Saturday at 2 o'clock and 7 o'clock.
Local charity ProKids has launched its first annual fundraising campaign called Power to Play. It's meant to give underprivileged children and youth access to recreational activities. The campaign will run through the month of April. There's a $50,000 fundraising goal. That amount of money could help hundreds of young people from families in financial need participate in sports, art, and cultural programs. Since it began in 1998, ProKids has placed more than 25,000 Thunder Bay kids into recreational activities.
And I think anybody who has the opportunity, whether it's sports, arts, culture, music, dance, you learn a lot. You create lifelong friendships. You learn about discipline, self-esteem, all those great things that come from it. You're not appreciating that at the time, but it's happening. And so lots to be proud of here from the city's perspective for managing and supporting this program.
Really positively affecting the entire family. So then the parents then also get the financial burden lifted, but then they also do get to see their children play the sports and be happy. So I think it's an all-around great cause.
Anyone who wants to support the Power to Play campaign can donate at local TD branches, the Canada Games Complex, or through ProKids Thunder Bay website.
What a worthy initiative that is.